Welcome back to the Inflammation Pandemic series. I'm Anjela, Holistic Medical Herbalist. In our last episode, we explored how inflammation in the cardiovascular system, particularly in the smooth muscle lining of blood vessels, can silently contribute to conditions like high blood pressure, type 2 diabetes, and the narrowing or hardening of arteries. I explained how, in many cases, this kind of hidden inflammation can be present even when routine blood tests don't pick it up, making it easy to overlook. We looked at how early intervention with the right herbs and dietary changes can begin to reverse these imbalances. And we highlighted the healing power of real, unprocessed foods along with herbal formulas like Hawthorn Plus and Marshmallow Root Plus to restore balance and protect the body at a deep cellular level. Today, we are shifting our focus to inflammation in the muscles and joints. But there's something important to understand. Muscles and joints themselves don't have smooth muscle lining. Instead, this kind of inflammation often originates elsewhere, such as in the gut or nervous system, and triggers autoimmune reactions that manifest as pain, stiffness, weakness, or nerve compression in the joints and muscles. There are two main types of inflammation in the muscles and joints. One is wear and tear from overuse or mechanical stress. This typically affects the specific areas such as knees, hips, shoulders, or the neck and back muscles. It's usually localized. The second one is autoimmune. This is more systemic. The pain tends to radiate or shift, affecting different areas at different times. It can start as early as the teenage years and often involves immune system confusion, where the body attacks its own tissues. Let's look at two real-life cases to understand this better. Case 1 is of a 22-year-old female. She came to me housebound in a constant pain. Even sitting caused severe muscle aches. All standard tests were done and she was diagnosed with arthritis and fatigue-related muscle inflammation. She had been on immunosuppressants for 3 years but with no real improvement. Tracing back her history, the trigger was a severe viral infection that left her with lingering aches and night sweats and swollen lymph nodes, especially on the right side of neck. This was a classic case of immune system confusion. The body still acting as if the virus was present and attacking muscles, joints, and nerves. We calmed the inflammation in the smooth muscle linings of her nerves, digestive tract, blood vessels, and lymphatic system. We supported detoxification using lymphatic and blood cleansing herbs. We removed common inflammatory foods like wheat, dairy, yeast, and processed items from her diet and focused on real whole foods. Within 3 months, she improved by 60%. After 18 months, she was off all medication. Her inflammation markers were normal, and she was pain-free, living a normal, active life again. So, what's the takeaway? The root cause was not in the joints themselves, but in immune system overreaction linked to inflammation in the smooth muscle lining, especially in the gut and nerves. Simply suppressing symptoms isn't enough. Healing must begin from within. Let's look at another case history of a person, a 56-year-old woman. She suffered from severe migrating muscle and joint pains. Even her ribs hurt so badly that she often ended up in A&E, fearing it was a heart. Her pain worsened after meals. She couldn't tolerate spices, lentil, beef, even ginger or pepper. Blood test and camera work all normal. So doctors prescribed painkillers and amitriptyline. When she came to me, she was so desperate, even suicidal, feeling she couldn't enjoy food, life, or her family anymore. This was clearly an immune system overreaction to food. The immune system treating digested food particles as threat leading to inflammation that affected her joints and muscles. So we modulated her immune system so it would still respond to infection but not attack her own tissues. We focused on healing the smooth muscle linings throughout the body. Her diet was simplified, just fruits, vegetables, fish and eggs. All processed, hybridized and intolerant foods were eliminated. By 3 months, her pain was down by 30%. At 6 months, 50%. After 1 year, she was eating with her family again and returned to part-time work. She no longer takes her herbs regularly, but keeps Marshmallow Root Plus and Berberries Plus for support when needed. So what's the takeaway? Even long-standing inflammation can heal, but it takes time, the right support, and a willingness to heal. For mild or early stage inflammation, where serious illness is ruled out by test, I recommend Wood Betony Plus, reduces pain and inflammation and supports immune balance, and Marshmallow Root Plus strengthens and heals the smooth muscle lining throughout the body. Take them consistently for 3 to 6 months and along with a whole food diet, avoiding wheat, dairy, yeast, and processed foods. For severe autoimmune conditions or if you're on immunosuppressants, please work with a qualified holistic herbalist who can tailor support to your individual needs. My deepest wish is for each of us to live life to our fullest potential. And that begins with a healthy body and a calm surface mind. When we support the body's natural ability to repair and renew, our inner energy rises effortlessly, allowing us to move through life with clarity, vitality, and purpose. Thank you for watching. In the next episode, we will explore chronic conditions like lupus, long COVID, and colitis, all rooted in inflammation of the smooth muscle lining. Stay tuned and be well.